Today, we have Dr. Sunil Agarwal, a cardiologist at Springfield Clinic, here with us to discuss COVID-19 and the heart. Good morning.
Good morning.
Well, during this pandemic, have you seen a change in the number of patients with heart attacks, or has the treatment of heart attacks changed at all?
Yes, there has been a decline in number of patients presenting with heart attack and stroke coming to the hospital. It is not obvious that the virus will cause this, but there has been behavioral changes in people, including diet and exercise, as well as there has been a big behavioral change in people trying to stay home and toughing it out when they're having chest pain and shortness of breath. We have seen a lot of delayed presentation of patients with heart attacks. What would typically be a simple procedure where they would get medications, get ballooned and stent, and have no long-term complications. We have seen this late presentation has caused complications such as heart failure and deaths. The treatment per se, some countries, they have gone towards giving more clotbuster medication rather than taking the patient to cath lab to avoid exposure to the healthcare professionals and workers. But I think US has stayed on with the guidelines of providing the best care despite the pandemic whenever somebody presents with a heart attack.
What advice would you have to patients out there with heart disease as this pandemic just continues?
It is very hard to differentiate the symptoms related to lung or related to esophagus or related to heart attack. This is particularly true in elderly, diabetics, and in women. And if you feel something which is different, then I would say seek care rather than just assume if it doesn't go away in a little bit. And at Springfield Clinic, we are available all the time through our telenurse portal, and the hospitals are open, and the emergency care, they have tried to make arrangements to reduce the transmission by all the providers wearing masks all the time and having non-COVID wards to take care of the patients. So I would say that the fear of transmission, we have to be cautious, but I think we should not stop interacting with the healthcare system whenever you have new symptoms.
Thank you so much, Doctor, for being with us. A lot of great tips.
Thank you.